Okay, this technique is called approximation. It is a technique that works on stability, and oftentimes it's done either before you're going to do some additional stability work, or it could be done during an active motion at the point of stability. So I'll explain both of those. First of all, what I'm going to demonstrate is approximation through Sadie's trunk. So the joints that I'm approximating through are her spine. So I want to make sure that she's sitting up tall, that she's not sagging. Okay, so if I was to approximate through her spine with her spine curved, I could potentially injure her, and this is not good joint alignment. So you've got to make sure that your patient is in a good sitting position. I'm just going to have you, there we go. Just a good sitting position so the alignment is great. All approximation is compression through the joint surface. So I'm going to be pushing down just a couple of times on Sadie's shoulder girdle, which then would translate that force through her spine. That's all compression or approximation is. Generally, it's followed through with another technique, either alternating isometrics or rhythmic stabilization. To illustrate the dynamic component of approximation, let's say Sadie is going to practice some weight shifting. And I'm going to have her weight shift toward her left, let your elbow, there. And I'm going to have her weight shift toward her right with nice, good equilibrium reactions. So as she's weight shifting through her left, if I saw that she wasn't stable, that as she was shifting, I could approximate through the arm. What I'm doing here is I'm stabilizing the elbow, because if I approximate, she could actually cave. So I'm stabilizing, allowing a little bit of elbow flexion for shock absorption, but I'm going to approximate while she's doing her weight shift. As she's shifting toward her right side, I wouldn't. As she comes back on the left side, if she needs some stability, I would approximate. Generally, I just do 2 approximations and then follow through with something.